Another thing that we do here is any kind of language therapy. So after stroke, sometimes people lose their ability to communicate with others. Strokes can take away your communication skills, which is a terrible thing to take away. So we can work with people with disorders with language coming in and disorders with language going out. We also can prescribe and help train communication devices for people to be able to communicate after strokes or with progressive diseases such as ALS. With that disorder, it's called aphasia. Aphasia training and treatment, we're kind of learning through research is that the most functional communication that we can do with our patients is actually helping them the most. And also with aphasia treatment, we do a lot of training of the caregivers to help them help their significant other communicate. So with helping with a receptive language disorder, we can give them strategies such as giving them multi-ways of getting the message in, such as written, verbal, gestures, to see if that can help. Also, it's kind of like any other therapy where if we train it and we hit it hard enough, your brain will refigure out a pathway to get to that injured area. And with the expression, it's very similar. We kind of hit on it. We want them to be able to communicate in a natural environment. So we'll do like role playing of like, you know, if we're at the Cardinals game or if we are trying to order food at a restaurant, you know, what would you say and how would you say it? It is a huge component. I've realized once patients start feeling better about themselves and their speech, they start doing better. And sometimes with aphasia and disorders, especially if they come to me long after their stroke, if I can make them feel better about how they sound or how they communicate, they often feel and understand and want to go out and communicate more and be more social, even if their actual deficit hasn't changed that much.